good morning.
Hi,
I'm
good
Colleen.
morning. I am Ashley. I'm going to present the board to you this morning. So we will start off with our quality safety, which is the active listening. We're making a big effort to make eye contact when speaking with our patients. The culture is professional resolution. It is time to start scheduling those fit tests. ED rounding, we're going to turn in your red hands ASAP. I know we had some staff that was kind of holding on to those, and they're going to get those turned in. And then for finance, we have 1 rad, 0 cath, 32 outpatients, 4 OR cases, staffed very well today, and we have Dr. Cho. Our first metric is the outpatient CCTAs are successfully completed without a delay 100% of the time. We've been doing really well on that this month. 100% of associates were observed utilizing hourly rounding, ED service scripting during daily spot checks by managers or peers. Also doing really well with that. And then all ED CT exams are completed within 60 minutes from time of order placed to end of exam 80% of the time. And we have also had a good little run of being green on that the last couple of days.
Nice job. So it looks like you've had some success with your ED metric for the turnaround time, but you had a stretch of red. What did you learn with that?
When we pulled, so I kind of went through and found those medical record numbers so I could kind of do a deep dive. We found that a lot of those were the GFRs, which is the lab, the kidney value that we have to wait on before giving the IV contrast. And I feel like with that, it's just kind of like a demographic issue because we have to wait on that lab value, so sometimes that pushes it past that 60 minutes because sometimes the labs can take up to 60 minutes to come back. So if they order the labs and the IVs at the exact same time they order the CT, we're already falling behind.
Nice. That's a great learning.
So
what do you think? So I know you haven't turned it out all the way with that, but what do you think your next steps might be with that?
I think that we need to maybe start looking at a trend with the ER patients as far as, Lauren mentioned it, maybe documenting if the patients are a hard stick or that it's hard to access the IV to get the blood to even be sent off to lab. In the ER charts they put if they're a difficult airway, so I don't know why a difficult IV stick or access would be also a hard thing to work on, but that would involve multiple departments, and so it's just something we can start talking about at least.
Love it. Thank you. Awesome. Can we talk a little bit about your process ops board?
Absolutely. So this is the process ops board. We pull one usually during the mid-morning and one with night shift. That way all shifts are included in this. We've been really good this week so far, green most days, but this morning we did pull and we did turn out red for our effective huddle. We do a huddle around 9:30 in the morning. We just kind of put it over the voice era. So Echo this morning wasn't able to attend. They had some patient care that they weren't able to step away from.
Okay. How do you know, I guess when you look at the card, what's the measurement for success? Like, how do you know you're successful?
Well, we asked that each person from a person from each department had come to that huddle, and then we just mark it off in our huddle book. So I was able to just go look and see that Echo was not here, and I just put today's date in there. So sometimes it says, we try and keep it, I put the criteria like short-staffed or call off in nuke med, nuke short, different things like that.
Okay, thank you. All right, so it looked like you had a few different misses over a period of time. How are you trending in general with effective huddle?
Well, we try and we keep track up here. We've been pretty green. I'll mark it as red for today. We like to, if we have maybe where it's multiple reds or 2 or 3 in a row of that card being pulled, then we like to kick it. Then that's when we would take that opportunity to kick it back to the Gemba board.
Awesome. Really good job. Anything I can do to support you today?
No, thank you so much.
Hey, really good job. Thank you.